Now, PolarityTE is a publicly traded company, and here are our forward-looking statements. PolarityTE is a commercial stage biotechnology and neogenerative company focused on improving the lives of patients with our regenerative tissue products. Our headquarters and our FDA-registered biomanufacturing facility are located in Salt Lake City, Utah, in the Mountain West region of the United States. PolarityTE's core platform technologies begin with the patient's own healthy tissues and harness the endogenous potential of the minimally polarized functional unit, or MPFU, in these tissues. The use of autologous tissue from the patient and for the patient avoids allogeneic tissue rejection and foreign body reactions that would complicate wound healing. The technology also focuses on maintaining the correct cellular niche and interactome of tissues, meaning that the tissues are being regenerated from their tissues of origin, so they're homologous. PolarityTE's foundational technology platform represents a paradigm shift from traditional tissue engineering approaches. The goal is not to overprocess or deconstruct the tissue. Rather, the aim is to maintain the inherent polarity that tissues have evolved with over time. And consequently, we are not culturing the tissues ex vivo. The patient actually acts as their own bioreactor, such that our products expand on the patient. And the significance of these platform characteristics will be demonstrated in the clinical cases that I'll show you shortly. PolarityTE started with skin. Skin is a very complex organ, and it has a significant regenerative capacity. Full-thickness skin is comprised of three major compartments: the epidermis, the dermis, and the hypodermis, each with a distinct barrier and censoring and immune functions, and they house unique cell types and accessory structures that enables the skin to really do its job well. Traditional tissue engineering of skin has generally employed relatively simple scaffolds, cell populations, and signaling molecules that are used in combination to replace skin that's lost during wounding. So on the left, you see a survey of the commercial skin substitutes that are out there, ranging from acellularized scaffolds, autologous cell suspensions, allogeneic and xenogenic structures, up to various biological composite materials. And what you can quickly appreciate is that this engineering approach does not reproduce the complexity of full-thickness skin. With its really distinct layered character and its full spectrum of hair, glands, vessels, and other accessory structures. In contrast, PolarityTE's first commercially available product in the United States, SkinTE, is an entirely different approach to neogeneration of skin. It's indicated for use in acute and chronic wounds, in trauma, burns, surgical reconstruction, and also scar revision. And SkinTE is truly personalized medicine. It's taking the patient's skin and optimizing it for wound healing in austere wound environments. SkinTE was first applied to patients at the end of 2017, and it has very broad applications, as I'll show you now. Here is an example of a patient with a diabetic foot ulcer. In the before picture, you can see that the wound has exposed bone and joint, which presented a real risk of infection, and made conventional treatment with skin grafting problematic. The healthcare provider elected to use SkinTE on this patient, and in the after picture, you see the wound healing that was achieved after a single application of SkinTE, including durable closure of the wound. Healing of a complex acute traumatic wound is illustrated in the pediatric case you see here. This injury was caused by a lawnmower, and you can see that there is exposed tendon, bone, and muscle in the before picture. A single application of PolarityTE resulted in the healing that's evident in the after picture about 12 weeks post-treatment, and the foot's range of motion remained intact after healing. Now, PolarityTE just launched 2 randomized controlled clinical trials, one in diabetic foot ulcers and a second in venous leg ulcers that are comparing PolarityTE to standard of care treatments. Here's an example of another diabetic foot ulcer from the pilot trial, and it was treated with PolarityTE, and the healing that you see achieved 21 days after its application. PolarityTE has been used to treat a variety of other cutaneous skin defects, as demonstrated by this slide. On the top left, you see an acute large wound of a patient who's suffering from necrotizing fasciitis. You can see the significant degree of exposed muscle and tendon in this case in the right lower extremity following surgical debridement. The patient was initially treated with split-thickness skin grafts, and PolarityTE was applied in the healthcare provider's clinic to treat the refractory wounds that occurred following grafting. On the bottom left, you see the case of a 2-year-old girl who presented to a burn unit with acute scald burns to both arms, legs, and chest. Several regions failed initial treatment with split-thickness skin grafting and were subsequently treated with PolarityTE. And in the after picture here, you see an example of early stage healing 1 month following her burn injury, including skin regeneration in the areas that were treated. You've already seen the case of the acute case at the top right. So on the bottom right, there's an example of a chronic wound of the left lateral foot that was caused by a traumatic crush injury. Following PolarityTE deployment in the healthcare provider's office, the patient experienced full thickness functional skin regeneration within the wound bed and full coverage of the previously exposed bone. PolarityTE has also been successfully deployed following Mohs surgery. As you can see on the images on the top left, the patient here had a history of complications with traditional local flap reconstructions. And 1 month following PolarityTE deployment, there is restoration of the 3-dimensional contours of the face, particularly without distortion to critical anatomical landmarks. On the bottom left, you see the example of diabetic foot ulcers. We've had a couple that I've shown you here today. On the top right is the case of a 10-year-old boy who experienced a severe flame burn injury and had been treated over a year earlier with traditional split-thickness skin grafting, and the graft developed severe contractions and keloid scars that limited his range of motion, particularly the movement of his arm and his neck, and led to chronic pain. After the graft was excised in an effort to treat some of this, it was treated with PolarityTE, and full-thickness skin was regenerated over the previously fibrotic wound and with restoration of range of motion. And finally, on the bottom right, you see a traumatic injury after a motor vehicle collision in which exposed bone, joint, muscle, and tendon were covered with PolarityTE, and functional skin was regenerated in the wound bed in this case as well. So how does PolarityTE look from the provider's standpoint? Providers are given a harvest box free of charge that contains everything that they need to take a full thickness skin harvest from an unaffected site. The box contains all of the necessary instruments, solutions, and transport containers, as well as a self-cooling return shipment box that enables the box to be sent to our FDA-registered biomanufacturing facility. There, the sample is processed and returned as a deployable material that is spread across the wound bed and bandaged using standard procedures that you would use for a standard skin graft. PolarityTE is designed to be a single treatment, and it uses established clinical workflows and reimbursement to be convenient for the provider, but most importantly, convenient for the patient. Now, depicted here is an example of PolarityTE deployed in a chronic wound. You can actually read more about this particular case in an article published in the March 2019 issue of the International Wound Journal titled "In Vivo Expansion and Regeneration of Full-Thickness Functional Skin with an Autologous Homologous Skin Construct." Now, this patient was a gentleman who was in a motorcycle accident and was dragged underneath a car. You can imagine that there were fairly severe wounds, particularly to his legs. One of his legs was successfully treated with a split-thickness skin graft, which you see over to the left, the right side, while the other developed a festering 2-year chronic wound that failed multiple prior split-thickness skin grafts and a number of advanced wound care products. And after a single application of PolarityTE, the patient experienced complete closure of the wound, which is evident in the images that you see at the bottom, showing wound healing over time. Now note, this is not healing by contraction, and this is also not migration in from the edges, but healing from the inside out. Furthermore, when analyzing the functionality of this skin through 2-point discrimination, there was comparable discrimination between the PolarityTE and the patient's native skin. His other leg that had successfully received the split-thickness skin grafting was much less sensate. And in addition, the PolarityTE treated area was hair-bearing, which demonstrates that PolarityTE is capable of recapitulating important aspects of complex skin architecture. Analysis of biopsies from treated patients provide some additional information about the characteristics of healed PolarityTE. Here you see stereotactic imaging and histological analysis, which show the development of mature rete pegs, the epidermis, the distinct layers of the epidermis, mature dermal collagen. This demonstrates that not only are the wounds achieving full closure, but most importantly, that full thickness functioning skin is being formed. Now, for more information, here's some contact information. You could go to PolarityTE.com and reach out to the following numbers or email addresses. And I thank you for your time.